We welcome in from the great state of Texas. We are joined by cardiologist Dr. Fahmi Farah. She is in Fort Worth, Texas, and practices in that great city. I know Fort Worth pretty well. My son and daughter-in-law live just across the 30 over in Dallas, doctor. So I know the area, and I know the area that you serve real well. Thanks for joining us.
Thank you for having me. It's always a pleasure to be on the show.
Doctor, I was just looking at the temperatures here a little while ago. 101 in Dallas today, 99 in Houston, 106 in Phoenix. If you go out 800, 900 miles through New Mexico and also into Arizona. Tough time. This can cause some stress on the heart. As a cardiologist, what are you telling people?
Totally agree that any kind of extremes of weather can cause huge amounts of stress on the heart, especially those who are, a little bit on the older side and have pre-existing heart conditions or risk factors. I really strongly advise them to avoid being exposed to the heat for too long.
How should we know? How should we start to know that our body is not liking the heat? What are the signs that say, hey, wait a second here, you may be in trouble?
Some of the signs are fatigue. You'll start feeling very tired. You can start noticing trembling, like shaking of the body, nausea, vomiting, just feeling your heart rate going up, so that sensation of anxiety, palpitations, and also headache, sweating can happen initially, and the sense of just losing control and passing out. All of those can be signs.
But it's something that comes on, it can come on pretty quickly. All of a sudden, especially if you're not getting enough liquids and enough electrolytes, you can find yourself in trouble pretty quickly.
Absolutely. I can't stress the importance of what you just mentioned, that it can happen very quickly. A lot of people think that it has to be prolonged exposure, and it doesn't, especially for those who are, the elderly and children. Their body reserve is very low, and they can get into trouble very quickly. And just to say from personal experience, I had an aunt with me just last weekend. We were just out for 5 minutes in the Texas heat, and it was just 101 degrees, 5 minutes, and she was in hyperthermia and almost in heat stroke, so we had to remove her very rapidly and cool her down. Thankfully, she did well. She did not have to go to the ER. I was with her and recognizing that and removing her very quickly. But just to stress that point, it doesn't take more than 5 minutes for some people to get into trouble.
Good situation that you being a cardiologist, you being a doctor, you having years and years of experience in the medical profession, you would recognize this and say, we've got a problem here.
Exactly, yes. And, the key here was removing her from that exposed area, into a cooled area. And we used ice pack and wet blankets to rapidly cool her and giving her hydration. So, water or any kind of electrolyte drinks like Gatorade, all of those would be helpful in those situations.
Let me ask you a question, because I'm the knucklehead type of guy who would do this. I like to be outside, like to play golf, like to get some exercise and the like. But I would tend to be, if I found myself getting overheated, I would kind of be the type of person who said, well, I'm just going to power my way through it. I'm going to just maybe get a water or a Gatorade or something like that. I'm going to power my way through it because that's kind of the way I live my life. But that's not necessarily the best course of action, is it?
It's not, especially in this level of heat. Sometimes we think we have the stamina and the strength, but really once your body reaches that threshold, it's out of your control. And so it really is important to not try to push yourself and not go through it, and not in this kind of heat. Just take the precautions and avoid the heat as much as you can.
And if you look at the temperatures, I'm going to just call up the weather temperatures here on my board. 101 in Dallas today, Lubbock 100, Houston 96, San Antonio 98, El Paso 98, Phoenix 108. Part of the problem is that cities don't cool down very much at night because they've got a lot of concrete, there's a lot of asphalt. You may not get temperatures in Dallas below 80 degrees tonight. Same thing with Houston, Lubbock, and the like. And then the next morning, the oven's already pretty hot.
Exactly. You're right. In all these areas you've mentioned, we've got a lot of buildings, concrete, and very little shade. That's one of the problems we have here in Texas, and that's kind of what we ran into. Even though we were out for just 5 minutes, it was out in complete heat for 5 minutes. There was no shade. And that's a problem. So the heat never kind of goes away, so to speak. Even at nighttime when it cools down a little bit, it's not by a lot because the concrete kind of retains the heat, and so we start all over again the next day. So, but that being said, like in the evening hours when there is no sun, it's still a little bit better. So those who are like runners, I worry about them because I see a lot of people running in the heat during broad daylight. I really would urge them to avoid that and try to save that until either really early morning when the sun is not as heated or in the evening time after sunset.
So if you're going to go out and run, 5:30, 6 o'clock, sun up time before it gets too hot, or maybe 7, 8 o'clock, temperatures have dropped, there's not as direct sunlight coming right down on you. That would be the way to go. Doctor, we're going to continue our conversation here on SiriusXM channel 146 in conversation with cardiologist Dr. Fahmi Farah. She works out of Fort Worth, Texas. Very, very impressive resume. Been a cardiologist in the Dallas-Fort Worth area for many, many years. Very successful, keeping people healthy, and that's part of what we do here at SiriusXM. 343, Dan Ronan for Mark Willis. We'll be right back. We go back now to Fort Worth, Texas. Dr. Fahmi Farah joins us. She is a Dallas-based cardiologist, and we are talking about keeping your heart healthy during these times of the year when the temperatures are extremely hot and challenging conditions as well. Doctor, a couple of weeks ago, I found myself cruising around on the internet, and I found an app for an app called Impulse. And once a day in the morning, it asked me to put my finger over my camera lens, and it does a little modification, does a little reading of my heart. Doesn't do the EKG thing, but are devices such as this a good thing? It gives us a little bit of information, but is a little bit of information a good thing?
Well, it depends. I've noticed, like sometimes it can catch important things. I have had patients that had come into the clinic after one of these devices, for instance, the Apple Watch, noted that they were having rhythm problems. Their heart was skipping beats. And so they came in for a checkup, and sure enough, their heart was truly having a type of arrhythmia. It's called atrial fibrillation, which is a very important catch because with that we can prevent, something like a stroke, which is very detrimental. So yes, in times it can be very helpful. But on the flip side, I have also seen patients that are coming in because they're just anxious, and because these devices are giving them a lot of alerts and sometimes not accurately. They could have a lot of artifacts. And so it's a tough call. I think for the most part, yes, my vote is going to be that, yes, these are helpful because I have caught several patients where it was life-saving in many ways.
I will tell you that, and I've shared this with our listeners, I've been type 2 diabetic for about 15, 18 years. I discovered it during a routine insurance exam 20 years ago, 18, 20 years ago. And I absolutely think that things like the Dexcom and the Freestyle Libre and the other wearable devices that are out there that give you so much information about your blood sugar, it has made management of my own situation so much better. I hated finger sticks to begin with, and every 2 weeks, I put a new sensor on. It connects to the app on my phone. I can tell you what my blood sugar is. My A1C is below 6 because I can monitor my eating and keep a real good tab on when I need to eat and all these sort of things. I think the technology that's out there that's working its way into the marketplace is revolutionary. I mean, it's mind-boggling how good it is.
I completely agree with you, especially in these technology that are available for people, patients out there, especially for those who live in remote areas and they don't necessarily have ready access to a hospital or a clinic or a doctor. These are great tools so that they can kind of monitor themselves. And if they have any concerns, they should always check in with a doctor, of course. And what I was trying to say earlier is, like, these are great tools for detecting things and saving lives. While that's true, for people to not become anxious over what sometimes they're detecting, and rather than becoming anxious, talk to your doctor and make sure that you go with your doctor's advice still.
Yeah, again, Dr. Google sometimes can really do a great job of scaring people, can it?
They can, and a lot of times they can give you wrong information as well. There's, nothing against the internet. There's a lot of great information out there too, but it's just that your source matters. So if you're looking up things online, which is, not a bad thing to do because you should be educated, and a lot of times people are trying to self-educate on the conditions that they have. There's nothing wrong with that. Just be sure that the source you're looking at is correct so that you're getting accurate information about your health.
What about telemedicine visits? That seems to be becoming much more popular, much more accepted. Certainly within the psychiatric world, it has become very acceptable to do meetings with a therapist via Zoom. My medical provider does it. I'm a little bit more old school. I don't mind going to the doctor because I think they can do a closer job of kicking the tires and, looking under the hood if they see you in person. But it seems as though there's much, much more acceptance of telemedicine, especially because of what happened with the pandemic. Who wants to go into a doctor's office when you're sick?
Absolutely. I am a big fan of telemedicine. Since the beginning of pandemic has really revolutionized the use of telemedicine. And the reason I'm a big fan is exactly why, what you just said. It has opened up the doors to people who could not come to doctor's office easily, especially those who are in remote areas, or even those who are very busy. Their schedule doesn't allow them to take that 2 hours out to physically go in for something simple, and they can now easily access their doctors. So it's a great tool. I think it gives a lot more access to medicine to many, many people, and I'm just so thrilled that we have a tool like telemedicine, and I'm thrilled to see what more we can do with it.
Are we really just, Doctor, at the early stages of this and the cusp of this? In terms of what the potential is? I mean, are we going to look back like anything else in 10 years and say, wow, what they were doing back in 2024, 2023 is pretty primitive compared to what we're doing now 8, 9, 10 years down the road?
Oh, absolutely. I think there's a lot more technology and advancements that are coming and are needed. Right now, we are very much at the beginning stages of what we are using in terms of telemedicine. For example, right now we don't have the tools to be able to examine the patient. We can see them through video. We can kind of gauge as to how they're doing, but it's still not a replacement for an in-person visit. It's not even close. So what I would like to see with technological advancements is a mediation between that, where we can maybe listen to their heart remotely. And I know that tools like that are being worked on right now with artificial intelligence and things like that. So it would be, it's very exciting to see what comes in the future. So I think it's only the beginning and we have a long ways to go.
You mentioned the words AI. Some people fear AI, but again, if we can use it to where, as a cardiologist, you're able to do an EKG or some sort of a heart exam on somebody, in a telemedicine setting where the person feels comfortable, they don't have to drive a half hour to the doctor's office, it's a routine visit, that could be a groundbreaking type of event, couldn't it?
Oh, absolutely. It would revolutionize the way we do medicine and the way we see patients in the outpatient setting, or even for emergency, for things that are not too emergent, like people who would go to the ER. I'm sure there are advancements we can make down the road where that initial visit can be done, like in urgent care, for example, remotely. With simple advancements like being able to listen to that patient's heart or being able to look at their, rhythm, the heart rhythm. And those are, I'm sure, not too far from reach because, as you know, just with simple tools like Apple Watch, we can get a rhythm strip, like an EKG read on the patient. So I think we are headed that way. And once we get to that stage of, mitigating how we examine some key components of the patient remotely, it'll completely revolutionize medicine, and I'm very excited for it.
Doctor, I know that COVID is not your specialty, but we are in a bit of a flare-up here from COVID right now. As a matter of fact, I had COVID 2 weeks ago. A very dear friend of mine has COVID right now and is battling through it as well. COVID is an illness that can affect your cardiology system. It can obviously mess your lungs up really bad. What advice, 3 minutes, 2 minutes left, what advice would you recommend in terms of keeping safe with regards to COVID?
Yes, COVID, there is definitely a surge going on, and the new variant is called FLIRT. It is a very contagious variant, and my advice would be that you continue with your precautions that you did during the pandemic to some degree. Like if you're taking a flight, for example, in an enclosed area with a crowd, try to wear your mask. That's still the best way to prevent it. Prevention is still the best way. Make sure you're up to date with your boosters and your vaccinations, and you're washing your hands. All of those are very important to prevent. And on another note, you mentioned with cardiovascular, association. Yes, COVID is known to increase cardiovascular disease. It can actually impact all parts of the heart. So very important for you to maintain those precautions to prevent getting COVID.
And, I mean, I'm healthy, and thankfully, but I got to tell you, for 3 or 4 days, I got the PAX into me, and they got me with the PAX thing, and that helped a great deal. But it's not a fun thing to go through, and this is the second time I've gone through it.
Yeah, unfortunately, it really gets you down. People are still getting high fever, severe weakness, and all of that. So, yeah, I really think that people should take the appropriate precautions.
Doctor, good to chat with you. I know you've become a regular here with Mark Willis on SiriusXM, Channel 146. You bring a lot to the conversation, and we're glad to have you as a regular here on SiriusXM.
Thank you for having me. It's a pleasure, as always.